Hi guys, we have a case of a 50-year-old male with severe abdominal pain, history of von Hippel-Lindau disease, and right nephrectomy for renal cell carcinoma. Let's go through the case. So let's just go from top down to see if we see anything that catches our eyes. The lung basis, I don't know if there's some nodules, some atelectasis. I'm unable to make it into a lung window. The pericardium and the heart, nothing catches my eyes. Let's go to the liver of the liver. The bile ducts are a little bit dilated than normal. Sometimes people with cholecystectomy can have this. And seeing these clips and not seeing the gallbladder, I would say this person probably has cholecystectomy. So I'll let that go. The stomach is distended, but again, I don't think I would make much of that. The spleen or some pancreas. Right. There's some pancreas. Okay, let's keep going down. There's probably a renal cyst here or some kind of hypodense lesion that I'm not so sure what that is. As I scroll down, these bowel loops here look really abnormal. The reason I know these are bowel loops is we can follow them. There's a lot of fatty stranding in the fat surrounding these bowel loops, and the wall is hypo-enhancing. So let's look at the small bowel loops, let's say here. See how bright, I mean, this ball is decompressed, but just see how bright the ball wall is and compare that to the ball wall right here. So these ball loops are hypo-enhancing. As I scroll down, I see this configuration where there are two loops squeezing in tightly. So for example, this is one loop, it's dilated here. It comes in, it has this like bird beak appearance. It's pinched off right here, and then it goes here, and here is where the abnormal bowel loops are. And then at a different place, I can follow this bowel loop out. And again, this bowel is coming from here. It's pinched off right here. After this pinching off, the bowel wall enhancement is good. It's enhancing normally. But before this being pinched off, right around here, these bowel loops are abnormally enhancing. So this is a case of closed loop bowel obstruction. So what is a closed loop bowel obstruction? Closed loop, this is a page from a website called Radiology Assistant. Me and a lot of radiology residents really love it. So closed loop bowel obstruction is that you have an obstruction and there's a closed loop in between. It can happen from twisting of the bowel loops around the mesentery. It can happen just from adhesions. It can happen from internal hernia. And what internal hernia is, I have this one image. Internal hernia is sometimes you just have this intrinsic defect in the mesentery, or sometimes it could be some kind of post-surgical defect, and loop of bowel just herniates right here. Am I able to tell if this is a case of internal hernia? No, I can't. But this is definitely a case of closed loop bowel obstruction. I do think that this bowel is ischemic given how abnormally enhancing the bowel loops are. Let's see what the case discussion says. So there's a closed loop bowel obstruction secondary. So this was a case of internal hernia in the right dorsal peritoneum. So that's what this case was. The discussion, abnormal small bowel loop in the right nephrectomy bed is impressive. You might think on the first, this is xanthogranulomatous pyelonephritis, but there's no kidney. And efferent limb of the arch narrowed and obstructing at the same location. So we did find this bird beaking. Given the history of nephrectomy and the tight focal narrowing result in closed loop obstruction, internal hernia cannot be favored over adhesion as the cause. It would be, okay, so again, I don't think I would have hammered it down as what's causing this closed loop obstruction. I think the main finding is that there is a closed loop obstruction and these bowel loops are ischemic. That's my diagnosis from this CT. I'll probably look more carefully to see if there's any free air. I'm just looking mainly at the anterior abdominal wall to see if I see any free air. Nothing. Do I see any free air around these bowel loops? No, nothing. Do I see any portal venous gas? No, nothing. Okay, so that was the case. Thanks for watching.